How to apply the four-quadrant approach in bioethical decisions. Have you ever wondered how healthcare professionals make tough ethical decisions? The four-quadrant approach is a practical tool that helps navigate these complex situations. It breaks down the decision-making process into four key areas: medical indications, patient preferences, quality of life, and contextual features. Let's look at how to apply this approach step by step. First, we start with medical indications. This quadrant focuses on the clinical facts of the case. Healthcare providers need to identify the patient's diagnosis and the possible treatment options. They also assess the risks and benefits of each option. Here, the principles of beneficence, which means doing good, and non-maleficence, which means avoiding harm, play a vital role. Clinicians must ensure that the proposed treatments are appropriate and beneficial for the patient without causing unnecessary harm. Next, we move to patient preferences. This area emphasizes the importance of respecting patient autonomy. It is essential to determine if the patient can make informed decisions. Understanding their values and wishes regarding treatment is crucial. If the patient is capable, their choices should guide the care provided. If not, decisions should be made in their best interests, often with the help of family members or advance directives. Now let's discuss quality of life. This quadrant examines how treatments will impact the patient's overall well-being. It looks at physical, psychological, and social aspects of life. The goal is to evaluate whether the benefits of treatment outweigh any burdens. Healthcare teams must ensure that interventions do not lead to excessive suffering or a loss of dignity for the patient. Finally, we consider contextual features. This area looks at external factors that may influence the decision. Cultural, religious, legal, social, and economic circumstances all play a role. Issues of justice and fairness are also addressed here. For example, healthcare providers must consider legal constraints, resource availability, and family dynamics when making ethical decisions. Applying the four-quadrant approach means working through these quadrants in order. This helps gather relevant information and analyze the ethical dimensions of each case. The process encourages collaboration among healthcare providers, patients, and families. It also helps clarify conflicts, such as when patient autonomy clashes with medical recommendations or when quality of life assessments vary. In practice, this approach guides clinicians to collect comprehensive clinical data and assess treatment options. They evaluate patient capacity and gather informed preferences. They also consider how interventions affect the patient's quality of life and address contextual influences, including cultural and legal factors. By systematically addressing these four areas, healthcare teams can make balanced and ethically justified decisions. This method aligns with the foundational principles of medical ethics that shape healthcare today.